is here with us again today to answer your medical questions and to share some important information regarding the many ways that this virus is different and more dangerous than the flu. We are reaching a pivotal juncture in our efforts to defeat the coronavirus pandemic. Over the weekend, President Trump urged the nation to brace for what he deemed a horrendous period during the next 2 weeks. We are seeing spikes in cases and fatalities in major metropolitan centers such as New York and in the New Orleans area here in our state. The Surgeon General of the United States stated yesterday that we are facing our Pearl Harbor moment in the coming weeks. Fortunately, we haven't seen that level of impact here yet. If we continue to be diligent, we are on a path to escape the level of infection being experienced elsewhere. But remember, we are the first line of defense, and what happens here is entirely up to us. So, to all of us, let's not be complacent. The Centers for Disease Control and Prevention has issued updated guidance urging our citizens to wear cloth masks when going out in public, whether going grocery shopping, to the pharmacy, or other essential activities where maintaining proper social distancing may be difficult. I sincerely hope our citizens will take this guidance to heart. Here in Lafayette Parish, we are up to 260 cases. We recorded 3 more fatalities over the weekend and 1 today, bringing our total to 6. We had a meeting with members of our medical task force this morning who alerted me to a concern that some of our citizens are waiting a little too long to seek care in an emergency room. If you find yourself in a situation where you would ordinarily seek care, for example, if you're having a hard time breathing, don't wait until the last moment. If you would normally go to the ER because you are in an emergency situation, please go. We are working to strike a delicate balance between not overcrowding our emergency rooms with cases that don't need to be there, while ensuring that there is a capacity for the people who really do need to be there. I want to thank everyone for your diligence, your common sense, and good judgment at this critical time. Our screening and testing site at the Cajun Dome was open again today from 8:30 a.m. until 10:30 a.m. We had a total of 95 vehicles come through, 76 tests were administered, and 19 were screened out. We will be open on Wednesday and Saturday for the remainder of this week. After this week, we plan to open on Monday, Wednesday, and Friday going forward, unless circumstances change. I remind and encourage our first responders, especially our frontline healthcare provider, including fire and police personnel, that you can always be screened to determine if you need to be tested during our hours of operation at the Cajun Dome. And just a reminder to everyone that if you need to be screened to determine whether you should be tested for the virus, please call 311 and press 1 to speak with a medical professional. You can also call 337-534-TEST, 337-534-TEST. If you are an employer who needs information about federal and state programs to help your business, or a person who recently became unemployed, please call 311 between 10 a.m. and 2 p.m. and press 2 to speak with a LEDA economic specialist. As always, we urge our citizens to practice social distancing, to stay home whenever possible, to wash your hands frequently, and try to avoid touching your face. These simple measures are our best way to slow the spread of this virus. In an unrelated but equally important note, I am saddened to hear of the passing of Dr. Ray Audemont. Dr. Ray Audemont passed away after an extended illness, and he served as president of USL and later UL Lafayette. Dr. Audemont lived a long and robust life, as he was 91 when he passed away. He served as our president of our university for 34 years, including the years where my wife Jamie and I were students, and we both think fondly of him. Due to the coronavirus, our community will not be able to have the kind of commemorative ceremony to celebrate his life and legacy that we normally would. But I'm sure we will take the time to do that at some point in the future when we are able to do so. While we're all at home, let's please take a moment to pray for Dr. Audemont, his family, the UL community, and all of Acadiana. He made an impact on our lives that will be felt for decades to come. Let's also please take a moment right now to pray for those who have passed as a result of the COVID-19 public health emergency, both here in our parish and across the world. So please join me. Thank you. I have time for a few questions. Dan.
Y'all gotten any medical supplies yet from the federal government? We're hearing that they're distributing thousands of things down to Louisiana. Are they coming here?
Regarding medical supplies? Yeah, no, and again, critical PPE. So I will defer logistical questions to both Craig Stansberry, who is, Craig's behind me back there. Craig leads our Lafayette OSEP department, but also Dr. Stefanski can speak on that. But I will, again, take this, you bring a really good point up. PPE, personal protective equipment. We still need gowns. We still need masks, shields, gloves. Gowns seem to be a little more in need right now through our healthcare facilities, so I urge you out there, if you're watching, maybe you're a dentist's office, or you work at a dentist's office, you're a dentist or oral surgeon, or someone in the healthcare industry or profession that your shop is closed right now, your office is closed right now. If you have this vital PPE, please come down to the Cajun Dome during our hours of operation this week, Wednesday and Saturday, 8:30 a.m. to 10:30 a.m., or you can come to Lafayette City Parish Hall here at 705 West University. Right in front, right behind me is a box. You can donate the PPE and log it in. So great question, Andrew. Any other questions of me? Yes?
Have you guys developed a plan yet for what you're going to do with the 850,000 you got in HUD funding?
Can you say that again?
850,000 y'all got in HUD funding through the CARES Act. Have you developed a plan for what you're going to do with that?
Oh, great point. And look, I'm so thankful to our Congressman's office, so thankful to our Louisiana delegation in Washington. They're working hard. So Christian referenced the 850,000 that we talked about, I think, last week, and from the CARES Act. And this is going to go through our Office of Community Development, and we're going to put that to good use. It seems to be affords pretty broad discretion as far as use, as long as it's in the realm of community development, which is good. But we're working hand in hand with our Louisiana delegation in Washington, also our local stakeholders, and our wonderful director, Hollis Conway, Director of Community Development, to make sure that these monies are put to good use. Any other questions? Yes,
Today, Governor Edwards said that he's going to start wearing a mask whenever he goes out to check public sites and stuff. Do you plan on doing so as well?
And we already are. So I applaud the governor for exercising not only good social distancing during his press conferences, I noticed, but also taking the recommendations of the CDC. And if you notice at the Cajun Dome screening site, I wear my mask, wear my gloves. If I'm going within that 6 feet distance, if I'm not going to enter in that 6 feet range, I try to preserve the PPE as much as we can to help our frontline healthcare warriors. But also at the Robichaux Center, through the wonderful funding of the Breeze Dream Foundation, you'll notice I have my mask on and my gloves. So again, I encourage all of our citizens, follow the recommendations of our president and our governor. Follow the recommendations of your local leaders here in Lafayette and Acadiana, and exercise good judgment. Exercise common sense. If you're within that 6 feet range, utilize the cloth mask. That's in accordance with the CDC guidelines and recommendations. Use PPE when available, and all of our business owners, I see more and more compliance. That's really good. So keep it up. That's how we're going to combat this virus. We don't need the government. We don't need the government to tell us how to exercise common sense. We got this here at home, and that's what we're going to continue to exercise. Any other questions of me? All right. So again, I appreciate all that you do. Thank you for this time. I ask for God's blessing on each of you and on our wonderful parish, state, and country. That being said, I'll hand it over to Dr. Tina Stefanski to answer any medical questions that you have. Thank you. Doctor.
Thank you. And I also want to acknowledge the 22 individuals to date who have passed away in this Acadiana region. from this virus. And so just, express condolences and sympathy to their families. And again, urge, all of us to understand the importance of continuing to follow those really common sense practices that the Mayor President just outlined. And so before I take y'all questions, just a few things. Again, I'm just here representing the healthcare community. There are hundreds of people that are doing the hard work every day caring for these individuals. And when I ask what message to share with individuals of Acadiana, the residents, the first thing that, that was expressed is, or they asked me to express, was on behalf of the healthcare community, a great thank you to the people of Acadiana who have just been wonderful providing PPE, some very innovative ways to make PPE, to again protect our frontline healthcare workers who are critical to us. And then also, of course, we're in Acadiana for providing food to, again, all those individuals who are on the front lines caring. So just a great heartfelt thank you, and they said to please continue, don't let up. Those efforts are very, very much appreciated by you healthcare workers, or the healthcare workforce here in Acadiana. I also just want to point out, this is a nationwide trend that, we're, of course, urban areas where you see the greatest, or the density of population, you have typically seen the greatest number of cases at this point. However, we are very concerned here in Acadiana. We're starting to see more and more cases from rural communities throughout Acadiana. So a message is, we embark on this wonderful week of Holy Week and people want to congregate as we're doing these case investigations. And as we talked last week, we see lots and lots of clustering among friend and family groups. So please try to continue to maintain a very small circle of friends and family. Don't expose yourself to a new group of people, and don't expose them potentially to something you might be carrying. It's just critically important. We're going to have to find new ways to celebrate this week, but we ask that you do not congregate, because very concerned we're going to continue to see this growing spread, especially in our rural communities. Also, I want to say, answer a couple of questions that have come through 211. Parish government asked me to address. One is that employers are asking what to do if one of their employees tests positive. So first of all, when we do these case investigations, we're urging the employees to notify their employer. If there's a clustering of cases, we will notify the employer. Employers can always call our office in addition to 211, and I'll give you all our number at the end. But some of the things that we tell you to look for is look at the work setting. If someone's in an office working with someone who tests positive, we'll suggest that person who shares the office be treated just like a household contact, and that they would be sent home for 14 days while they monitor their symptoms. Everyone else in that work environment, depending on what the situation is, will probably be recommended. It'll be recommended that you all wear a mask, that your temperatures be checked at least 2 or 3 times a day, and monitor for symptoms. But again, we're available to help answer those questions. And then outstanding tests. I'm happy to say that over the weekend, several tests that I personally was following for individuals started to result. So I'm thinking that backlog must be starting to clear up. So I'm hopeful that over the next, now we'll see a quicker turnaround quicker turnaround for testing, but that's not a guarantee. So that's all of my remarks. Do y'all have any questions? Oh, no, one more, sorry. I do want to talk about flu, because it's very shocking to me to hear that people are still comparing this to the flu, and are not worried, not seeing that this is such a big deal. Why are we taking all these measures? What's the concern? So that's really a message we need all of you to share with your friends and family, is that this virus is more deadly than the flu. It's easier to catch than the flu. It's more communicable. So just a few stats. Transmission, the flu, normal, if you have the flu, you might transmit to 1, maybe 1.5 people when you look at the data. With this virus, without social distancing, one person can spread to 2 to 3 more people. With social distancing, we drive that number down. So it's very much more communicable, easier to transmit. Hospitalization, about 2% of people who are infected with the flu are hospitalized versus about 20% with this illness. That's huge. Length of stay is much longer. We talked last week from flu, average length of stay might be 5 to 6 days. With this virus, it's closer to 11 to 13 days. It's a long time in the hospital. And the fatality rate, with the flu actually has a very low mortality rate, 0.1%. This virus, the fatality rate varies among countries, but it's anywhere from 1 to 3%. So 2 to 3% is typically what we've been reporting. That's a much higher rate. Flu is 0.1. We're talking about best case scenario 1 to 3%. So very much more deadly. We have about 200 people hospitalized in this region at this moment with this virus, and 1/4 of those are on ventilators. about 200 people hospitalized in this region with this virus, either pending or COVID pending or COVID positive, and a fourth of those people are on ventilators. So that's how devastating for that person and their family. They're on a breathing machine to help support their breathing. So this is a very serious illness, much more serious than the flu. We need people to do what you can to help prevent the further spread so that we can all get back to a more sense of normal life. And the only way that we're going to get to that is if we really take action. You've heard the federal government on down to our mayor, president, and our governor that this is a very important week. We need to do what we can to remain, again, to avoid large crowds of people, avoid congregating. And when you are going to be out, if you're going to the grocery store, the drugstore, consider wearing some kind of face covering to protect everyone else from anything that you might be spreading. So now I'm done. Y'all have any questions?
Big adjustment to
This
some of the
weekend, yes.
parishes this weekend. What was that about?
Yes, thank you for, I meant to say that. So y'all probably saw between Friday and Saturday, there was actually a drop in numbers for Acadiana, and this actually happened statewide. And the reason is, we've talked about these commercial labs, more and more commercial labs are coming on board with testing. So it was the way that the commercial labs were reporting to us. There was some duplication of test results. And so we moved to a different reporting platform over the weekend, and it removed all those duplications. And so going forward, you should not see that, happen again.
Is there a way for y'all to clarify, like, how many cases were actually added on Saturday? Right, because all we have is a dip in the number as opposed to how many
new
were
cases?
actually removed.
No, I don't know that at this moment. We definitely had new cases because, our nurses were hard at work on Saturday notifying, calling individuals, not notifying, calling them and doing the case investigation. So we absolutely had an increase, but I'm so sorry, I don't have that. Any other questions?
So there's been a lot of talk this week, as the Mayor President noted, about anticipating the peak, the worst part of the season. Where does Lafayette Parish or Acadiana more broadly fall into that? I mean, my sense has been we've been a little bit behind in terms of the course. Is that still the case as far as the peak is concerned? Or?
So it is expected that we will fall a little behind New Orleans. And so I don't know if y'all saw the modeling that was released on Friday. It's on the LDH website. We have modeling that's been done for the New Orleans region. And so they really show that the peak, or the anticipated peak, which we hope is not quite the peak, right? We hope it's a blended curve, is now looking maybe more towards May, when we were talking about it, perhaps been a little bit earlier. So we expect to fall in line with New Orleans, or behind New Orleans. But the hope is that when you look at those curves, and I encourage everyone to look at them, when you implement effective social distancing, rather than a peak, you just get a blip. And so if, as the Mayor President just said, if we can all stay the course and continue doing what we do and don't let up, then the hope is that here in Acadiana, we will avoid what we all frankly fear in the healthcare industry, is that big peak, because there is no healthcare system that can respond effectively to such a great peak or such a huge influx. So, if we can spread the load of the virus, spread the infections out over time, then that's going to help. It's going to be in all of our best interests. The healthcare community will be in a better position to care for you, following the normal, wonderful standards and practice of care that we do. So that's the goal, is to stay the course, don't let up, so that, again, instead of this peak, we'll see just this blended curve, which probably will be a little bit behind New Orleans, but they are working on the rest of the state, just started with the modeling in New Orleans.
Just to be clear, we would be past the next 2-week period that has been described nationally as the Pearl Harbor moment, that kind of thing.
Exactly, yes.
And so does that mean we're going to be under stay-at-home longer than April 30th, you think?
Hopefully not. Well, I don't know about past April 30th. I guess we'll have to wait and see.
And the peak is expected
So it's a
in May.
peak, but it's right. And so actually, when you look at it, it's not such a great peak. It's more of a little blip. So I think over the next couple of weeks, there's going to be a lot of modeling, a lot of mathematical geniuses working with healthcare to put all this together and try to anticipate what might happen. But again, even at the national, federal level, this is a question nobody can answer. We don't know when the peak is going to hit, what that peak might look like. There are some anticipated projections, but that's all we can do is project.
Okay. So I emailed the DHH in Baton Rouge this morning asking, because of the changes with reporting nursing home, and what happens if a cluster is identified in the nursing home? the nursing home contact the family, DHA. The response was long-term care facilities are required to report positive cases to the state, but each facility makes its own decisions about how to communicate with families. Does that mean they don't have to tell everybody, the family of everybody in that nursing home?
So the question is about nursing home notifications and family members of individuals who are in that nursing home. So we work with the nursing homes to, of course, when there's from one case to a cluster, we actually start working with them prior to any cases to make sure they're following correct infection control practices to prevent clustering or outbreaks of cases. And so in that case, we do work with the families on the positive, in those cases that are positive, and we encourage the nursing homes to notify family members of all the residents that they are seeing cases. I'm not sure that I'll have to verify with our health standards department.
I know that we heard a lot about hydroxychloroquine and Zithromax today, about all that was being obtained and that it's being tested at different LSU University hospitals, including here in Lafayette. Can you talk about that a little bit, explaining what it might do, and also it's being tested here. Are people being tested already, or is that coming soon? So
that's it's a clinical trial looking at the safety and effectiveness of this combined drug regimen, and so it is reserved for individuals who are hospitalized under the care of a physician, and these medications are being tried with the hopes that these most severely ill individuals will see a benefit from this regimen. Again, we talked about this last week. These are not medications that people should call their doctor and ask for, because there is actually now a shortage of medications. So for people, example, who have lupus, who are having difficulty obtaining this medication, someone in our office can't get this medication for their lupus, and so because it's not available through the pharmacies. So we really encourage people that this is clinical trials, hospitalized patients under the care of a physician, not for people out in the community who are wanting to prevent or treat something that they think they might have, again, as an outpatient. It needs to be reserved for those people most seriously ill. And it's too early for us to know what the the results of the clinical trials are. They just started not too very long ago. But I think it's hopeful.
One more question.
Mm-hmm.
The governor said that something like 70% of the people across the state who have died from COVID-19 are black today.
Mm-hmm.
Are we seeing a similar racial disparity here?
So I'll have to get the stats for Acadiana region. I knew statewide that, of course, absolutely is the case, and hypertension is a huge risk factor. So again, not typical, not what we usually see with the flu. We know how many people in Louisiana, hypertension is a very common chronic illness. And so this is one more reason for all of us. We all know people, lots of people who have high blood pressure. So this is just one more reason for all of us to take this seriously, to try to avoid spreading infection to other individuals. Consider covering your face when you're out in public, and again, avoiding crowded situations, because there's just not a lot. There's a lot we don't know yet about why that particular chronic disease is such a great risk factor. And one more thing to say about the medication that you were asking, we also want people to know that there are side effects, particularly cardiac side effects from one of those medications that have been tried. So just one more reason that we ask people not to try to attain this medication through their physician or local pharmacy, and also reserve it for those people who need it to treat those illnesses for which we know it's effective. Thank you.
Just a reminder, public playgrounds and recreational areas are closed to the public. We've gotten reports of people utilizing basketball courts and playgrounds. Please stay out of those areas, even if they aren't marked off. They are within that order to stay home, to stay away from. You can utilize the walking tracks and green spaces. And we also acknowledge that it is Holy Week, which is typically a very special time for families in this area. A lot of us get together, we celebrate. Resist the temptation. It's going to be tough on all of us. I know that we all had plans to do stuff this Sunday for Easter. Unfortunately, we can't do those. And there are ways that we can all do it together separately, if that makes sense. So just keep that in mind as we go through this week. Lafayette City Court, all court sessions scheduled prior to May 15th have been canceled, and they will be rescheduled. The City Court building will be reopened to the public on May 4th, tentatively. The court hopes to resume limited court sessions beginning May 18th and expects to return to normal court sessions by Monday, June 15th. If you have a court date, do not call the courthouse. A notice will be mailed to defendants. However, it is the defendant's responsibility to ensure the court has your current address and contact info. It must be provided in writing and mailed in. Limited staff is working to handle court matters currently. If you have business with the court, you can continue to file civil pleadings, evictions, criminal pleadings, and other matters by mail or fax. It does not mean they will be evicting people. It's just that there is some paperwork involved, and after this is said and done, that paperwork will need to have been filed. You can find more information on the items and other court matters we didn't discuss at citycourtlafayette.la.org. Cajun Dome screening site update. Mayor President put it out earlier. Just a reminder, Monday, Wednesday, Saturday, not this Friday, in observance of Good Friday. And next week, it will pick up at Monday, Wednesday, Friday, same time, 8:30 to 10:30. Again, the Mayor President encourages first responders in Lafayette Parish and the municipalities, police officers, firefighters, sheriff's office, and healthcare workers, if you are showing symptoms, go to the Cajun Dome screening site to get screened, but only if you're showing symptoms. If you're feeling fine, if you're feeling healthy, it's unnecessary. But if you do have some concerns, you can dial 311, option 1, speak to those medical professionals. I do not have the updated 311 numbers. I will work to get those for you as soon as I can. But as always, that call center is open 24 hours a day for anyone concerned about whether they should be pre-screened. If you live outside of Lafayette Parish, 337-534-TEST, 337-534-TEST. 211 is the number to call for other questions related to COVID-19. Lunch distribution is going well and running smoothly at the Robichaux Center. We continue to give out boxed lunches daily, beginning at 11 o'clock each morning on Eras Landry Road. So first come, first served, and 2 meals per car. They typically start to get pretty backed up around 10:45. So I would suggest you get there earlier, and they go quickly. And no dogs, please. That is for your safety and for the safety of the folks that are handing out food. Same rule applies for the Cajun Dome Screening Center. The LEDA call center, 311 option 2, where the Lafayette Economic Development Authority continues to help employers and people who've lost their jobs navigate loans for employers and unemployment insurance for employees. I believe the SBA loans went live late last week, so there have been still a lot of questions about that. So if you have questions, give them a call. Call 311, select option 2 from 10 a.m. to 2 p.m. Today they fielded 34 calls. 29 of those looking for SBA information, 26 had questions about unemployment, 6% had questions about the stimulus package, and about 6% of those callers are laid off of work and looking for employment or unemployment. If you're looking for work, go to the LEDA website. As of 2:50 p.m. this afternoon, 28 area employers are hiring. So there are folks out there that are hiring if you are looking for work and you're concerned. We're still going to give out paper copies of that information from 10 a.m. to 2 p.m. Today, only one person drove through. They got some SBA information. So this is here at City Parish Hall, 705 West University. You can drive through and pick up that information. And a note for business owners, the only way to check the status of SBA EIDL loan applications is by calling this number, 800-659-2955. Again, that's the status of SBA EIDL loan applications, 800-659-2955. For our healthcare workers tirelessly working on the front lines, 232 Help has established a meal fund at the Community Foundation of Acadiana. This initial funding was made possible from the Jewel Parkerson Lowe Foundation. Over the next 7 weeks, Imanelli Restaurant will deliver 10,000 or more meals to emergency rooms and critical care workers at Lafayette General, University Hospital, and Our Lady of Lourdes. More donations are needed to expand the feeding program to cover additional hospitals. To keep it going, citizens can make a tax-deductible donation by visiting this website, cfacadiana.org cfacadiana.org/232-HELP. That's cfacadiana.org/232-HELP. Then go to 232-HELP Healthcare Heroes Meal Fund. If you want to mail a check or donate from your donor advised fund, call 769-4844 for more information. 769-4844 for more information.